$40 million in requests. Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson Wolff. We're joined tonight by Metro Health Director Dr. Claude Jacob, and this is our COVID-19 update for the San Antonio community. Very first, let's take a look at our positivity indicators, or excuse me, our progress indicators. And I do want to note that our positivity rate has dropped once again. It's now 7.1%, and that is again consistent with more testing that we've been seeing in the community. Our case rate has also dropped to 44.5 cases per 100,000. Our health system remains in the upper end of the high stress score, but is continuing to show improvements. So our risk level remains moderate, and we are continuing to monitor these indicators, especially following the Labor Day holiday. Let's keep masking up regardless of vaccination status. If you're still unsure about getting vaccinated, I encourage you to consult with your healthcare provider and visit covid19.sanantonio.gov to get answers to your questions. Now over to the cases today. We're reporting 775 new cases of COVID-19, and our 7-day moving average is now 818. Unfortunately, we are reporting 6 new deaths this evening, so please keep their family and friends who are missing loved ones in your prayers. We are over 4,000 of our neighbors that we've lost during this pandemic, and so we know many families are without, and we need to remember them as we get through the next several months. There are 1,016 patients in area hospitals, and over the last 24 hours there are 127 new admissions. 329 folks are in the ICU with COVID-19 and 194 on ventilators. 84 patients in the area hospitals are unvaccinated. 84% are unvaccinated, and 20 patients this evening are children. Let me turn it over now to Judge Wolff.
Well, thanks. It looks like everything's going the right way, but it's a slow way down. Every time we've gone through this, is our third major wave. It always goes up fast, but it takes a long time to come down. So we just got to be careful. Can't let up yet. We still got over 1,000 people in the hospital. Way, way too many. You read a little bit about probably today about the difference of opinion on whether you need the third shot or not, the booster shot, I guess I should say, be third for the Moderna and for the Pfizer. And while there may be some differences of opinion, the FDA, I think, is going to meet this Friday and will, I believe, make a decision whether to go forward with the booster shot. And if it does, we will open back up at the Wonderland Center, University Hospital, Bexar County Hospital District, offer them, but it's really, you need to let 8 months expire before you get it. But we don't know yet what they're going to say, and we'll be staying tuned to what happens on Friday with the FDA. The Tobin Center had an opportunity to visit with some of the board members and regarding the Tobin Center. I'm really proud of what they're doing. They're being very careful with their events. You have to wear the face mask. It's mandatory if you're moving around. If you're sitting down, they certainly encourage it. But the minute you get up and move around, they require the face mask, and they're providing face masks for everybody. Another interesting aspect, I never did know this, but some artists are very adamant about people have to have a vaccination to come in, or they have to show a negative test results. About a third of the performances there, the artist wants it that way, so they do require vaccination, or they require a negative test, or they refund them and let them go home. So I think the Tobin Center is making every effort to make sure people are safe. We will start the free flu shots, not the COVID, flu shots as we're entering flu season. I got mine just late last week. But we're going to be doing it at the Freeman Coliseum. It's going to start at 8 o'clock in the morning. Free. It was very efficient. I think we gave over 2,500 shots one day in last season. So if you want the flu shot, you want it to be free, come out and see us at the Freeman Coliseum, 8 o'clock on Saturday.
Thank you, Judge. And as you heard last week, City Council approved an incentive for vaccinations. Metro Health will be offering $100 HEB gift cards to fully vaccinated people who get vaccinated at a Metro Health site. The gift cards will be issued beginning later this month. Individuals who are already fully vaccinated are not eligible for the gift card. You can rest well knowing that you have done the right thing to protect yourself and the community, however. The gift cards will be given to individuals who receive either the one-dose Johnson & Johnson vaccine or both of their doses of the Pfizer or Moderna vaccine at Metro Health vaccine sites. Gift cards will not be given on a retroactive basis, and to be eligible for a gift card, people must have received their vaccine series after July 31st. To learn more about that, please visit covid19.sanantonio.gov. That's also where you can find a testing location if you need one, or you can call 311, hit option 8. And in the meantime, please wear a mask and get vaccinated. Please do it for yourself, do it for your family, and do it for San Antonio. We are not out of the woods yet. We're going to be paying very close attention to the numbers this week to see where we are after the Labor Day holiday. And knowing that our holiday season is coming up, we also need to do what we can to bring those numbers down because the hospitals are still overloaded. So with that, the judge, myself, and Dr. Jacob are available for questions.
Dr. Jacob, the numbers over the past several days suggest we are coming down from the peak. Is that how you view the situation?
Thank you for the question. Again, we remain cautiously optimistic. What we've been reporting the last 2 weeks is that we still remain at a moderate risk level. As you can recall, this COVID experience has been something that's kept us on our toes. So just know that we went 4 weeks straight where we were at the severe risk level. We now have seen consistently that we're now at a moderate risk level. We've reported out a decrease in our overall positivity rate as well as our overall case rate per 100,000. So we remain vigilant. We remind residents to mask up, to get vaccinated, to maintain the appropriate social distancing where possible, but by all means to be safe out there. Again, remain vigilant. That's really the take-home message for residents.
Bruce, let me add one other thing. With regard to the seriousness of the situation, and I forgot to mention this earlier, we are also in the midst of a blood emergency, so we do desperately need folks to sign up and donate blood either through the University Hospital or at the South Texas Blood and Tissue Center. You can also go to southtexasblood.org, but we have less than a one-day supply of type O blood, which is a severe issue. Because we rely on that for all trauma care, for pregnancies, surgeries, things like that. So if you are depending on the medical system at all, the blood emergency needs to be of concern to you. And so we need businesses to go schedule drives, and we need folks, individuals, to schedule donations.
Can we safely say that there was not a Labor Day surge?
So again, it's too early to tell. Obviously, we've been reporting out what we see to be positive news. So the positivity rate has dropped. But we were still paying attention over the course of the next week or so just to see the complete picture of what we would attribute to the holiday gatherings. So we remain vigilant. We'll report out next week as always, but just know that we know that this virus loves company. And so each holiday we try to at least remind folks to take the added precautions, but we're not out of the woods yet. We remain vigilant, and we'll report back next week.
So what do you attribute the improving numbers over the last couple of weeks?
Let's be humble here. Again, we have been messaging this. We have been working with our partners. We appreciate your help in getting the word out. We're reminding folks the importance of getting vaccinated, so we're pleased that over 70% of eligible residents over the age of 12 are now fully vaccinated. We are well pleased to see that over 86% of eligible residents over the age of 12 has at least received one dose. So we continue with the incentives to roll out our incentive campaign, which is starting next week. But we're also reminding folks of the importance of masking up. So we're taking every added precaution. we're not out of the woods, but it would be difficult to attribute it to one measure, but just know that we're throwing an entire constellation of mitigation measures here, and we're pleased to see at least the trends these 2 weeks.
Dr. Jacob, could you give us a firm date when the incentive program is set to start?
Yeah, so as we reported out since last week, and thanks to the City Council and the City Manager for their support, so we know before the end of the month. Right now, we're lining up all the logistics, which included a staff training that occurred today in terms of the handling of cash. We do have the gift cards that we are procuring from HEB, but just know that we will announce the date and time and place when folks who are eligible can receive the gift cards once they complete their vaccination series. So we'll report back out, but before the end of the month, that's our target right now.
And with our positivity rate and total case rate dropping, are hospital, I guess, trends also going in the same direction?
Well, the hospital numbers are trending down, but also trending down very slowly. But to emphasize, the level of activity that's in the hospital is still of a concern. I mean, we're not, we still have nurses, we have contingent teams of nurses that are in from out of town. We have people working triple time at the hospital. So we're still at a level of activity where it would be a big mistake to let up with our mitigation efforts.
What are the recommendations for this year's Halloween or trick-or-treating celebrations with unvaccinated and vaccinated youth?
Thank you for the question. I think it's too early to talk about Halloween, but let's at least remind folks, last year, based on the guidance from the CDC and from at least guidance from our state level partners, we reminded children and parents to take added precautions last year. And so you'll see consistency with that. But the guidance has not yet been released, but just know, different from last year, we do now have vaccines made available, at least for those 12 and older, but we'll make sure to message out accordingly. It's still early, and we are reminding folks each and every week of the importance of paying added attention during the holidays, especially as we move through the next few weeks.
With this wave, the major difference that we've seen has been the vaccines, the availability and the consistent number going up, with over 70% of eligible residents, like you just mentioned, fully vaccinated at this point. If we were to see another wave, would we think that the vaccines would be able to stand up against it?
Good question. So we know that the vaccines are effective and the vaccines are safe. So we've been publicizing this. We've been reminding folks, again, it's a personal decision to get vaccinated. We're pleased of the uptake so far, but we also know that there are pockets of the San Antonio community and Bexar County that we have not gotten the same uptake. So we're staying on message. We're reminding folks we're making vaccines available. It's free of charge. And so whatever we can do to incentivize it, like we're doing with the rollout later this month, that's been our main measure, on top of reminding folks to wash their hands, mask up where possible, and just maintaining the appropriate distance, especially if they're indoors.
You mentioned being able to reach those communities that maybe aren't as vaccinated as others. I know when looking at the map, there's some that have a 5% fully vaccinated rate, or maybe lower than 10% in some cases. How are you guys working to make sure that they have the same opportunity as others, whether it's the technology gap or being able to get to a vaccine clinic or anything of that sort?
Good question. So we realize that we have quite a diverse landscape out there. We have the urban core within the city, but we also know we have the rural parts of the county as well as the unincorporated parts of the county. So we are working with our partners on the ground, the faith-based organizations, the area providers, whether it's social media, whether it's billboards, whether it's just making sure that we use the radio ads, TV ads, public service announcements. We're throwing everything out there. We're pleased by the uptake, but recognizing that it's an uneven level, especially in the some parts of the city. Attention, especially for the parts of the San Antonio community, the east and west parts of San Antonio, where we're leaning in even more, especially with our community health workers and other ambassadors on the ground.
Labor Day having passed already, we have 3 more holidays, major holidays coming up before the end of the year. With cases trending downward and with hospitalizations starting to trend downward as well, how vital is it that we get closer to a valley before those holidays begin to come?
We're leaning in as much as we can, and to your point, if you go back to what we've had over the course of the last year and a half, we do know that the holidays tend to be an accelerant of sorts. Main reason, this virus loves company. And so we're paying closer attention. We're over messaging and making sure that folks pay added precautions, especially during the holidays. So we're not out of the woods by any stretch. We are paying attention to the impact on our area hospitals. We are asking folks to mask up. We're reminding folks of the value of getting vaccinated, which is different than what we had as a measure last fall. So all that to say that we lean in, we forge ahead, and we remain vigilant, especially through the holidays.
Do we have an update on staffing for, I know staff was being brought out of town in some cases, but for the hospitals, are they still in need, or?
You're talking about the nurse teams. We had several hundred of them in town. You're talking about those, Amanda? Okay. I don't have a specific number, but we can get that from STRAC.
And I don't know who to direct this question to, or if y'all would even have this information, but have you guys heard from pharmacies in the area about any upticks in prescriptions for ivermectin?
Which medicine?
The dewormer.
Oh, for the cows and the horses?
Good question. We can look into that. I have not heard, but I wouldn't be surprised if at least there have been some pings out there. But we'll look into that and report back.
You know, some of the feed stores have quit selling it. I think it was Johnny's feed store up in Bernie, I think, took it off the shelves because so many people were buying it. Got to pay attention to the FDA. You're not a horse and you're not a cow, so quit taking it.
Judge Wolff, could you just give us a briefing on the budget that Commissioners Court passed today?
Well, we passed a $2.79 billion budget today. Within that budget, we gave a 5% raise to our employees, which are really important. We substantially increased law enforcement. We've added some 17 positions to the Sheriff's Office, civilian and uniform, and we've added 32 positions to the constables. And so you're going to see a beefing up in both of those areas. Most important, I think, in the budget, we had a 10-year program that we put in place for $617 million in projects done over within the next 2 years. $187 million of that is dealing with roads and streets, $110 million with flood control, and then we have $244 million for 27 different creeks and trailways, which we think is really important. And then we also have $74 million in there for park improvements in our park system. So a very strong capital budget, and we believe that when you have a good, strong capital budget, you're making investments that will pay off for the future. So I think overall it's a very good budget.
Director Jacob, I just want to be clear. Are you saying you want to see the Labor Day numbers manifest themselves in reporting before you declare that Bexar County's reached a plateau in hospitalizations or case count?
It would be wise for us to at least wait to see a complete picture through next week. Plateau, it's too soon to tell. What we have been reporting out is that we've seen a steady decline of 2 consecutive weeks. But just know that those 2 weeks don't make for a trend. So we are cautiously optimistic. The trend lines are moving in the right direction. We're seeing an alignment of what we're seeing with our positivity rate, our overall case count per 100,000, the admissions to the area hospitals. So that's good news. But for now, we at least want to see through next week. That gives us a more complete picture, and we'll report that out.
That's all we have tonight. Thank you.